And just to let everyone know, we currently are live.
How about now? Can you guys hear me?
Yeah, I can hear you and see you.
So we are live, right? I guess everybody's here. We'll call the meeting to order. I'd just like to remind everybody that this meeting is being recorded by audio and video. And just to say that pursuant to Governor Baker's March 12th, 2020 order regarding open meeting law, municipalities have been granted a variance to conduct meetings for boards, commissions, and committees remotely until rescinded or until the state of emergency is lifted. One of the things that we won't be doing for this meeting is accepting public comment. So with that, I know it's been a hectic couple days with the last order amendment to that order we put in with the one person. So I'd like to maybe have Roberto start.
Yes. So over the past few days, we've seen a sharp increase in requests to do work, for the one person. I'm sure all of you have probably been getting emails and all sorts of messaging about that. If you can give me just one moment, I got to look something up.
I don't know what you mean, read it out. Read what out? Do you know?
Okay. So, Malcolm?
We could explain that, yes.
Yes.
Do you want me to do that?
Yeah.
Okay. So can everybody hear me okay?
Yep.
Okay, so at last night's select board meeting, you gotta mute, everybody gotta mute. One of the items that the board has on its regular agenda is an update about all things COVID related. And one of them had to do with the board's prior meeting happened before the Board of Health's emergency meeting this past Monday, where you adopted the supplemental order, which basically is the Board of Health's adoption of the stay-at-home order. We went through all of that on Monday, and what was added to that order was this allowance for a one-person job that could potentially be done again by a single worker who is the sole employee or worker on a job site. I'm just reading from the order. Other than at an occupied property and work done by individuals on their own property, provided further that such job site or property is not otherwise subject to additional state and federal workplace laws and regulations, and first that such work can be performed without delivery of additional materials, including tools, parts, paint, lumber, and the like. So after this order was issued, we were somewhat besieged by people asking a lot of different questions like, can I send the electrician in the morning and the plumber in the afternoon? Can I send the electrician in one day and the painter in the next day? All manner of things like that. Can I have somebody working on the inside and somebody working on the outside? So the answer to pretty much all of that is no. That is not what it was intended to do. But what we were seeing was an increase in calls about numerous people, again, being at work sites. So one of the things, anyway, this was on the board's agenda last night, and one of the things that we thought we had heard earlier in the day, which turned out to be not quite accurate, was that the High Line had more workers coming off on Wednesday than it had on Tuesday. That actually was true. More workers did come off the High Line on Wednesday than Tuesday. However, we were basing our information on observations from a police officer who was down at the High Line when it came in yesterday morning at 8:45. And the observations were just that, observations. It wasn't a head count. And the estimate was that there were close to 100 people who came off that boat, and they appeared to be workers who perhaps were in the construction industry because they were tools and lunch boxes and things of that nature. So we subsequently asked the High Line to provide their numbers, which they did, and the number of passengers that they provided to us today was 44 that came off the High Line yesterday morning. It was in fact double from the day before. The day before, 20 came off. So it's anybody's guess as to why there was an increase there. We maybe made an interpretation that is or is not accurate about more workers coming off because of the allowance now for the one person jobs. So that I'm only mentioning it because that was used in the discussion with the board last night, after which the board ultimately voted to make a recommendation to the Board of Health to reconsider that paragraph that is at the very end of the supplemental order that you all adopted earlier in the week. The emergency management team's recommendation continues to be to remove that language because the existence of it is causing us to spend virtually all of our time dealing with these one-off requests that don't really meet the criteria that's even listed in this paragraph. So our thinking right now is just take it out, as we discussed last night at the board meeting, and we're trying to put in place ways in which the Plus Department and potentially the Natural Resources Department can help put together something of a get back to work plan that meets the guidelines of the state for essential services of construction and landscaping that the town will be able to enforce. Right now, the regulations are such that, and guidelines are such, we can't possibly enforce those things. Is there a way to allow certain very specific types of work that could meet the guidelines and could be monitored and tracked and enforced by the town? So we are very much focused on working on that. We very much understand the need to get people back to work. We are, again, besieged, bombarded, whatever, with requests for people. I need to work. We get that, but there is an overwhelming public health emergency here that supersedes the need to work, basically. Anything else you want to add, Roberto?
No, I think you've hit the nail right on the head. It's still incredibly important to maintain this shelter in place. I think one of the big parts of what it is we're trying to get done here is just how do we move forward while still maintaining the public health. Cases do continue to increase. It is just the nature of this virus, and the more people are out there, even if it is by themselves, increases the risk. So I just very much agree with everything Libby just said, the assessment. So I still think we should move forward with the amendment to the supplement. So that being said, I did send the supplement via email, the modifications. We have had that reviewed by counsel, who is also available for questions. But as of right now, I think let's see what do you think? What is your opinions on the amendment?
Anybody? Malcolm?
Yeah, I understand this is not an easy situation. We're talking about people's work. We're talking about public health. What's the timeline of, you talked about going forward or having plans to start letting people work again, or I forget the exact words that Libby said. What's the timeline on that?
So the timeline is definitely not within the next few weeks. We're still expecting a spike in the state of Massachusetts. So what we're looking to do is, as is already written in the supplement, that we will be reviewing it every week. To quote Dr. Fauci, we actually have the quote here on our whiteboard that you don't make the timeline, the virus makes the timeline. It's really dependent on how the virus reacts in our community and how the virus is reacting statewide. So as of right now, we recommend taking it out, but also reviewing it as time goes on. It can be 2 or 3 weeks. It can be 2 or 3 months. I'm saying 2 or 3 months just because we don't know how long the virus outbreak can be. But it's the virus's timeline. And I think, Jimmy, I saw that you were talking, but you had your microphone muted. So make sure you unmute. Jimmy, you're muted.
Doing what we've asked them to do. And the only worries that I seem to have, seeing that everyone thinks the next week or the next 2 weeks are going to be a big spike, is my worry is people coming over on the boat and people coming in at the airport on planes. And my question is there anything that we can do, maybe not on the Nantucket side, but on the Hyannis side, where the High Line is, by putting flyers out, or is there any way we can kind of limit the amount of people coming before they actually get here on the boats?
Pretty much now it's just essentially personnel.
So looking at my advisors here, thank you. What it sounds like is that it's pretty much now, it's already just essential people. A lot of people have already paid attention. There was that spike in the last day or two, that regardless of whether our physical count from the police officer was off, there was still more people on that boat than there have been in the last week at least. So we are seeing that when the ban is in place, the only people coming forward are essential. One of the trips even showed that it was only 6 people at one point. And that's can be anywhere from our off-island EMTs to FedEx people and nurses. So in general, people are paying attention, because the message is definitely out. And they do have signs already on the Hyannis side. So it's if they don't know not to travel at this point and they're still traveling, it's going to be very difficult to even change those people's minds.
Okay, thank you.
Anybody else have any more questions? Colleen?
Helen, you're muted. There we go.
Okay, and so now can you hear me?
Yes.
Okay. I just think looking at the numbers, the fact that we've done 135 plus tests, we only have 8 people who have tested positive. None of them are severe enough to be hospitalized. I think that's a result of the mitigation procedures we've been going through. And I really feel we've had a very serious request from both the hospital and the medical profession that we continue to do what we're doing. So I think we do need to remove that amendment and, as you say, do a weekly review.
Malcolm?
Just to follow up on Elaine, I mean, the numbers, I think we should be modestly proud of those numbers, but remember there's a significant number of false positives in testing. And there are probably people on this island that we have the virus and we don't know yet. So I think it's time to be as strict as we can be, at least for the time being.
Dawn?
Just a question procedurally. So will we have this on our agenda every week for discussion and updates? Will the Board of Health be scheduling a weekly meeting as well? Will it be before or after our meeting? I'm just trying to figure out how we're going to keep a handle on this.
I think it's a good idea that we can have, because Don, I think you're on the daily phone calls as well. So with the original delegation of authority that the Board of Health gave to myself to start enacting some of this work, I think between the information that we get and the information that we're pushing out and the information that, like Libby said, we're being besieged by information and questions, I think we can make that determination of putting it on the agenda. We are in the Emergency Operations Center every day reviewing that information. And I think if we get to the point where we can put it on the agenda, we can definitely either put it on that weekly agenda for the Board of Select or the Select Board, or also call that Board of Health meeting at that point. Correct me if I'm wrong in any of this.
Mel?
If we pass this, I think it has to be clear we're not doing it just to make life easy for our town officials because they're getting barraged or whatever the word it is. We're doing this for a health reason, not to make life easier for our already overworked staff.
Yes, a major part of the outbreak is that we have to work with the information that we have. Sometimes the information comes in as super quick and can't be always 100% validated in a short period of time. We're doing the best we can with the little that we have. So I agree with everything with the sentiment.
Rita?
Yeah, I just wanted to say that, as I said last evening, I'm in full support of removing that last paragraph and making it clear to trades that really and truly, if you're not essential, then you should be at home. Just to let everyone know, I'm in full support of removing that.
Anybody have anything else to add?
I just ask one more question. if there is an emergency in someone's home, say a woman's home with 2 kids and there's a leak in the 2nd floor and the water's pouring down through the ceiling and it's an emergency, what would they do? Would they call the police department and try to get a special permission to have a plumber or an electrician come to solve the problem that they have? How would that work?
So for the immediate building issue, if you can get a hold of the building commissioner, that's the first step. And we're doing our best to not hold any of that up. So yes, you can do that work, but they do call building first, and then from there it comes up to us, and we are responding to those as soon as we get them. If it's a road issue or some sort of a road opening, then you would contact DPW first.
Okay, thank you.
Yeah, I think there's a lot of misconception out there that, the avenues are there. You hear a lot of people complaining that I left a trench open and now I can't fill it in. And that's a matter of public safety and liability. The avenues are there, whether you need to go through the building commissioner, the Board of Health, Chief Pittman. So just to let everybody know out there, if something is considered essential, which something like that would be, the avenues are there to get it done.
Absolutely. We're not trying to let people's buildings, people's homes get damaged, people's homes get, destroyed or anything like that. It's definitely the avenues are there. Absolutely.
Does anybody else have any comments about the amendment? So I'd like to make a motion, and then I'll have Lauren correct me if I'm wrong, but this is how I would like it to read. And so if I could get a motion to remove the wording and/or the last paragraph of the emergency amendment of the supplemental emergency order adopted March 30th, 2020 by the Board of Health, and to adopt this supplemental emergency order as written today. Lauren?
Mr. Chair, yes, thank you. I'm wondering whether we could just say vote to revise the supplement by deleting the last paragraph and continuing such amendment in all, and continuing such supplement in all other ways as decided. What day was it? I can't remember. 2 days ago?
It was Monday.
As decided on whatever the date was.
Yeah, Monday, March 30th.
Monday, March 30th.
Thank you.
So can we get a motion as to what Lauren just said all over it? Or do you need
I'll make that motion as read.
Can I get a second?
I'll second.
And we will do a vote by roll call. Jim Cooper?
Yes.
Helene Weld?
Yes.
Malcolm McNabb?
Yes.
Rita Higgins?
Yes.
And Chairman Steve Visco says yes. Although the picture says Abigail, I'm on my daughter's computer.
You have to work with the equipment you have. Okay, and I think the next...
Any more comments or questions or board member concerns and updates?
I think one of the comments that we wanted to make sure we connect here was also the question has been had about opening restaurants. After discussion with the staff today, with my staff via email and chat, they're recommending against opening it because of the amount of person power it takes to do inspections, do new permitting, do the whole thing. I think I think one of the things that it comes into is we just don't have the bandwidth to be opening all of this as well as doing our current enforcement and everything that we're doing. So I think what we're going to end up doing is probably holding off on any inspections for new establishments and permitting new food establishments until at least the governor's moratorium is over, which is, I think, right now, May 4th.
Yeah, and then, I mean, if it was really a necessity that you needed more restaurants open to handle any type of food, or, I mean, that's something that you could do anyways, right?
Correct. So, for example, we're working on a program with a food pantry and a couple others that they may need a little bit more space. So we have the ability to work with them to get them a larger kitchen or something like that, somebody who's volunteering space. But as far as new permits, things like that, we're just not at that point right now.
Right. One thing I may ask about the potential, the April meeting had a lot of things on the agenda. Is that meeting will be pushed off, and Regulation 51 in Nantucket is slated to be implemented at that meeting, but there are some, I think we may have to open the public hearing and change some of the language that's in that 51 that's now.
That's an excellent point. We did table the hearing to the April meeting.
Yeah, I would suggest we table it again. I don't think it's too soon, and it's a very complicated, a very important issue, and I think we have to let the public speak, and it's very hard in these situations. I mean, I would move. I'll make a motion that we.
I don't know if we can.
We
It's not on
table
the agenda.
until
It's not on the agenda, yeah.
That's right. I can't do
We
it.
could do something for our next.
Next time we meet together, I would request that we put it on the agenda.
Yes.
Yeah, absolutely. We can definitely put that on the agenda. I know it's already scheduled for the third Thursday, which is April 16th. So what we can do is open the meeting, reopen the public hearing, table it.
Or if we have another one of these ad hoc meetings, whatever.
I think because we tabled it to a date certain,
Right,
it was
you're
April
correct.
16th.
You're a better parliamentarian than I am. I'm sorry.
So we will have to reopen it again on April 16th at 4 p.m., which was our original set time, and then we can table it. If town council is here, so if she has any
I'm
comments.
nodding. Yes, that's correct. Because you continue to a set time, date, and place, although the place will be changed in accordance with the governor's order, you do have to open it at that time, date, and place, and then continue it again, or table it, or whatever else it is that you want to do with it.
Yeah. So you bring up a great point, Stephen.
Yeah, I think this is a little bit more pressing. We got to get through this first.
Yeah. No, absolutely. And it's just another thing, it's something that we got to think about that as we go to reopen the town, as this time is passing, there is going to be an onslaught of things that have been on the back burner, or even just downright shelved until afterwards. Like you said, this is a little bit more pressing, and it's a discussion that definitely needs to be had, but I think we should, when we reopen it, we'll have to table it again. And I would even recommend at that point probably 90 days, even or more.
Yeah, we'll talk about it. Yeah.
Yes.
Anybody else have anything? Any concerns? Rita, you're all set? Good? Okay.
All set. Yeah. Thank you.
Yeah.
And motion to adjourn if there's no other questions or concerns.
Sorry?
Is it? Are you ready to adjourn?
We can be, we'll, so it was just brought to my attention that on April 16th, Concom has a meeting at 5 p.m. So because we tabled the hearing to that specific date, we do still kind of have to meet. So I know Concom is at 5 p.m. and we had scheduled our meeting for 4 p.m. It would probably have to be a meeting that we can do just that one agenda item and then be off.
Right. I think that's easy enough. Right.
Okay.
Would everybody be good with that?
Okay.
Yes.
Yeah.
Good. Yeah.
Okay. If that's, can I get a motion to adjourn?
So, yep.
Second?
Second.
Okay, by roll call, Malcolm,
Yes.
Rita,
Yes.
Helene,
Yes.
James,
Yes.
Chairman says aye. Meeting is adjourned. Thank you, Lauren.
Thank you.
Thank you.
Take
Thanks,
care.
everybody. I'll be in touch.
Discussion about a new illness and its impact on the United States. Hi, I am Roberto Santamaria.
And I'm Gary Shaw. This virus is a respiratory illness called novel coronavirus, or COVID-19. This outbreak started in China and has spread to several other countries, including the United States.